Hi guys, today we are going to study benign salivary gland tumors, which include pleomorphic adenoma, monomorphic adenoma, Whartins tumor, oncocytoma. Some common clinical features which are shared by all the benign salivary gland tumors are that they are well circumscribed and they are well demarcated. They have a fibrous capsule. They have smooth overlying skin. They have intact mucosa or skin, which means that they do not have any breach in it, and they are movable, and they have a normal skin or mucosal color. As you can see in the picture that it is well demarcated and it is having a normal color as well as smooth overlying mucosa. First benign tumor is pleomorphic adenoma, which is 60% of the time common in parotid gland. The myoepithelial cells, these are the myoepithelial cells which divide into epithelial and mesenchymal component. The epithelial cells are cuboidal or they may be ovoid, having a eosinophilic cytoplasm and the centrally placed nucleus. As you can see in the diagram that there are sheets, tubules and cords of epithelial cells which are round to ovoid, and there are adipose cells. They basically consist of eccentric nucleus and they have clear cytoplasm. When pleomorphic adenoma becomes malignant, it is called as carcinoma ex pleomorphic adenoma. Secondly is monomorphic adenoma, which has a single epithelial cell type. Based on the architecture, it has two types: basal cell adenoma and canalicular adenoma. Basal cell adenoma occurs in the parotid gland, and as parotid is also big, the tumor is also big, which is more than 3 cm. And the canalicular type occurs on the upper lip mainly. As the upper lip is small, so the tumor is also small, which is less than 2 cm. The basal cell type has two types of cells, the basal cells and the cuboidal cells. As you can see, the basal cells are almost ovoid and the cuboidal cells are cube shaped. So these cells form nests and tubules. In the nest, the outer cells are cuboidal and the inner cells are basal. In the tubules, it is opposite. The inner cells lining the tubule are cuboidal and the outer cells are basal. The canalicular type has cuboidal to low columnar cells forming anastomosing cords. Now comes the third benign tumor, which is papillary cyst adenoma lymphamatosum, or you can say Whartins tumor. It mainly occurs in males. It has a doughy consistency and it is movable. During radioisotopy, it takes up technetium 99M per technetate and becomes red hot nodule. Microscopically, there are cystic spaces which are lined by double cell layer of columnar cells. The columnar cells in the lower layer have nuclei towards the basement membrane, and in the upper layer they are away from the basement membrane. There is lymphoid tissue and germinal centers as well. Now comes the last benign salivary gland tumor, which is oncocytoma, and it has polygonal or cuboidal cells called as oncocytes, and they basically have granules. These granules are actually mitochondria and they have pycnotic nuclei. The oncocytes are present in the form of nests, and these nests are divided by fibrous septi. Thank you so much for watching the video. Allah Hafiz.